Okay. Hello, everybody. Welcome. Are you ready for me to kick it off? Okay. All right. Welcome, everybody. My name is Joanne Snapp, and I am with the UCR Health Professions Advising Center to do this workshop. I just want to give you a heads up. This workshop is being recorded, and we will post it on the UCR's YouTube channel. So don't feel obligated to turn your camera on. I'm going to turn my camera off as soon as I start presenting. But please feel free to ask questions in the chat. I'm happy to answer any questions that you have. So without further delay, I'm going to share my screen and we are going to get started. Today, we are going to talk all about California secondaries. And I know the title says UC Secondaries, but we're going to see how many we get through today. And if we can get through all the UCs, then I have the other California schools up there as well. So we are going to jump right into it because there is a lot to talk about. Some of you have probably come to my previous secondary workshops where I talked about getting organized. And if you haven't had a chance to watch that, definitely watch that because that's what you need to know in order just to get started with this whole process, which can be really overwhelming. Just some fun facts about UC secondaries to kick it off. So UCs do screen for secondaries. They typically will screen based on their own internal criteria, which from what I've heard, it includes things like where you're from. So zip codes can sometimes determine when people get secondaries. Different qualities of an application. So sometimes people are put into piles and screened differently and sent out secondaries at different times. Not everybody gets their secondaries on the same day. There's no way to know what the criteria is for different UCs to know like why did one person get their secondary a week before the other person. And so trying to figure that out or worry about it is, in my opinion, kind of a waste of time. I would just you kind of hope that you're going to get one. And when you get one, you're excited and you just try to do it as well as you can and turn it around as fast as you can. But try not to worry too much about when it's going to come because it can come anytime between now, like at the beginning of July, whenever secondaries are released, all the way through October. I've had people tell me they didn't get their secondaries from a UC until mid-October. So if you haven't got it by November, oftentimes it's a sign that you're not going to get it. And, that doesn't feel good, but it does happen from time to time that someone doesn't get a UC secondary. So let's jump into it. Since we're at UCR, I figured we'll start with UC Riverside School of Medicine. So their prompt is, the mission of the UCR School of Medicine is to train a diverse physician workforce to meet the needs of underserved communities in the inland Southern California. What experiences, skills, abilities will you bring to the class to fulfill this mission? So they're looking to serve the Inland Empire. We know that a lot of schools have regional preferences. And whenever you're looking at a particular school that has a regional preference, and you guys are advantaged because you've been in the Inland Empire for the last 4 years. So knowing what the challenges are in that community, you would want to think about what is it that you see yourself doing in the future that would address one of the challenges that the community faces. So you would be specific about maybe picking out a community that you're particularly interested in or a challenge that you've seen, and you would tell a story about where you've seen that challenge, whether it was working at a hospital or working at a free clinic or doing some other activity. It doesn't have to be clinical, but somewhere where you've seen maybe one of the systemic challenges that exists in the Inland Empire. And you would talk about, having seen that, what is it that you bring to the table that allows you to be qualified to address something like that. So for example, if you notice that a certain population is struggling to access care because of, let's say, their visa status, and they have a lot of fear and mistrust in healthcare. If you have a particular perspective or insight about that community, you could talk about being able to build trust and reduce that fear and increase access to medicine by providing the type of appropriate and welcoming, inclusive care that that community needs. And so It could be a variety of challenges, but just pick one big one and hone in on that, and then talk about what you bring to the table. And the next question, so looking at the mission statement, they're asking you to choose one of these values and talk about a time when you've demonstrated it. So you would literally pick one and tell a story about that, and show. Always at the end of every secondary, you want to tie it back to the school, tie it back to medicine, and say why it is that you understand this particular value is important. So for example, with inclusion, oftentimes people will tell stories about, maybe having felt othered at one point in their life, and kind of paint that picture of understanding what being othered feels like, and how that inspires them or has kind of driven them to be very sensitive to other people feeling excluded in spaces. And so that kind of drives them to have a strong inclusive practice wherever they're at. So when you get to medical school, you'll make sure that all of your peers are always feel included. You're very sensitive to any bias that others may be feeling. Try a very safe and welcoming environment wherever you are. So that's an example of tackle any of that. But you could do, research with innovation. You could do a clinical experience for integrity. You could talk about, research for excellence. There's so many opportunities here to highlight things that you've done, but you kind of approach this in the same way you did a personal statement paragraph, with a story and a reflection at the end. And then there are, a lot of schools will actually ask you what specialty you're interested in. I know there's a lot of kind of fear out there, like, should I say what I'm interested in? What if they want this? What if they want that? In my experience talking to medical schools, they typically want a diverse class that has a variety of interests. So no, I don't think any med school wants an entire class filled with people who want to go into primary care. There are a lot of schools that have a primary care focus because it serves their mission. But if somebody wants to do specialty care, it's not like they're going to be discriminated against or discouraged from doing that. And so I think it would be best to be honest here and say that you're very open to, to learning about different fields, but right now your interest is in whatever. And support that with showing why or how it is you came to that realization that you want to do this thing. And then a personal challenge, you probably will need to write a personal challenge essay for a lot of different schools. And so personal challenges can be anything from like a personal life experience, which if you had a lot of challenges in your own life, you probably wrote an impactful experience description already. So a lot of people are kind of challenged in the way where they're like, well, I already told them everything in my impactful experience description. So what do I talk about now? Well, you could take one of the things you mentioned in your impactful experience and just dive in a lot deeper, kind of show through a more specific example how a situation challenged you. So it could be anything from growing up, in poverty, or living with a person who has mental illness, or it could even be a clinical experience. If you had a challenge where you worked with a very difficult person, um, anything at all is perfectly okay. But what you want to do is you kind of want to show, especially when they're asking you, how did you demonstrate resilience and grit to overcome it? You want to show through your eyes, through your own brain, how you reacted to the challenge, how you thought through it, how you problem solved. You kind of want to show us in your mind, like, how did I get to this? How did I overcome it, basically? But if as detailed as you can from your point of view, how you thought through the problem is what's more important. It can't just be like a miracle one day it just got solved. You need to show them how you worked through that problem. This is not necessarily a failure question. This is more of like something that you have faced. So something that has happened to you. And so that's like being put in a situation that you didn't necessarily create is what a challenge is. Does anybody have any questions about these kinds of questions? Contributing to an area, interest in fields, or challenge questions? These are very common questions that you could see in different schools. Okay, then we shall keep moving. All right, so these are previous year's prompts, and they can definitely change from year to year. Hopefully they don't change too much. But if they do change, like I said, usually the questions are very similar across schools. So you can see here that UCR or UCI had a challenge question as well. So even if you wrote something and the school changes the question, there's a good chance you're going to end up using it anyway somewhere else. So don't get too upset if you wrote something that you don't end up needing for that school. You may just have to write something new for their new question. So this is an interesting question. What personal accomplishment are you most proud of? And this just gives them a chance for you, or gives you a chance to kind of brag on something that you did. But I would try to think about something that's really meaningful to you. So you could talk about, having been published, if that really is your most personal accomplishment. But when I think of personal accomplishment, I don't think of like a professional accomplishment. I think of something that you have overcome in your own life. So I think that opens it up to talk about, non-clinical or non-research or non-school related things. Like one thing I'm thinking is, I was a first gen income student going to college, and all of the odds were stacked against me, right? Like I failed classes. I didn't even know what a syllabus meant when I first started. So I was one of the only people I knew that went to college, and all the odds were stacked against me. I should have probably dropped out and, worked in retail for the rest of my life. But I persisted. I worked 2 jobs and did all these crazy things to make it through. And so that would be a personal accomplishment. That may not be true for everybody, but if, something like that applies to you, that could be an accomplishment if you highlight the challenges that you went through to get to that accomplishment. So similar to the challenge question, you could talk about in a challenge question, you could talk about a challenge, an academic challenge, although I really would encourage you not to do that if you have the option, because that is sometimes everybody's go-to is to talk about the C they got in OChem, or, just how hard first year of college was. And for a lot of people, first year of college was hard, and a lot of people, OChem was hard. And so there's not honestly a very unique way to talk about that, that hasn't already been written hundreds or thousands of times. And so if you have any other kind of more personal or more unique examples of challenges, I would always encourage you to go that route over the grades, because your C and OChem or your first year bumps that you have maybe on your transcript, honestly, those things are not phasing them in the same way that they're probably phasing you. They see this stuff all the time. So they're not getting hung up on your C and OChem. And if you waste an entire opportunity to talk about something else more meaningful just to explain why you got a C and OChem, in my opinion, you're wasting an opportunity to highlight the value that you bring to medicine, over something that doesn't necessarily matter. Does that make sense to everybody, or does anybody have any questions about that as to why we wouldn't, um, talk about a single bad grade? But if you have like a significant academic challenge, meaning, you got dismissed from college, or you have 2 years where you had like a 1.5 GPA, that's a significant challenge. You could talk about what happened during that time frame that led to that, and then, kind of reflect on how you grew from that and what you learned about yourself. And then the last question here is more of like since you've graduated, what have you been doing? Which again is an extremely common question. It's really straightforward though. All you're going to do is just outline in a paragraph format what you've been up to since graduating college. And some of you maybe haven't even graduated yet. So in that case, you could talk about what you're going to do. And keep in mind that med schools want to see you working full time. If you are not in college, the expectation is that you're doing a full-time job. If you're not doing a single full-time job, then you should be doing 2 part-time jobs, or a part-time job and several, volunteer experiences. But basically, you need to be busy. So if you just say, oh, for the next year, I'm just going to volunteer at a couple places, that's probably not going to suffice, because you have a college degree. So in their minds, you should be working full time. So if you can, try to get your jobs lined up as soon as you can so that you can talk about those jobs in your secondary. And it would be better to say you are starting a particular job than to say, I'm looking for jobs. So if you really don't have a job and you have to say you're looking for jobs, that's better than nothing. But in my opinion, I would rather you say, I'll be starting full-time scrub work at such and such hospital starting on July 1st, where I intend to learn this, this, and this. Well, if you started on July 1st, you'll be able to actually talk about it by the time you submit this, because this probably won't, your secondaries probably won't come to you until at least the first or second week of July. So maybe those are things you don't want to pre-write. Maybe you want to wait until you actually start your job. That way you can accurately reflect on what you have been doing since you started and be able to say what you're learning so far. All right. So Davis. So Davis is a little bit like UCR. So UCR really likes their Inland Empire people, and Davis really likes their Northern California people. That's not to say that you can't get in at either place. I have had people from the Bay Area get into UCR and vice versa. But you have to prove to them that you really do want to be there and that you're willing to stay there, because that's the goal. They're trying to all serve their region. And so what they're screening for people who want to stay in the region. Now, if you're from Northern California, this is a little bit easier for you to answer. You would start by talking about your family being in Northern California. You would literally say where your family lives. You would talk about living there your whole life, except for the 4 years you went to UCR, and why it is you want to train in Sacramento. If you have never been to Northern California, you've never been to Sacramento, if you have no experience or no connections to Northern California, this is hard because you have to basically convince them that you really would like to be there, and with no references. So you could try to pull a parallel. You could say, having lived in such and such city your whole life, which is very similar to the urban underserved communities in Sacramento. Maybe you could pull, show what something you've done. I mean, this is such a short paragraph, like it's 500 characters. So you're not showing anything actually. You're just going to say like, having served such and such community in this city, I want to bring the knowledge I've gained to the underserved communities in Sacramento. Maybe look at one of the 9 student-run clinics they have, mention which clinic you're interested in, and literally just say that you're very committed to serving both the urban, underserved, and the rural communities in Northern California or Central California. So like I said, if you're from the area, you need to show explicitly your connections that convince them that you're going to stay. If you're not from the area, you have to do your best to convince them that you want to be there. Any questions about that? I would try to mention Sacramento somewhere in your answer just to make it clear that you know like what you're going to be doing when you're there. But beyond that, you just have to do your best. For the activities question that they ask, a lot of schools ask you to basically rehash your descriptions that you already wrote in your personal or your AMCAS app. And that's confusing and annoying because you already wrote them all out and you're like, why am I writing these again, but now much shorter? And the short answer that I believe is true, I have no, we don't know because none of us are behind the scenes, but this is what I suspect. I'll go back to the first question, sorry. So for the last question, my guess is that they pull the secondaries and give the secondaries to certain people to read as part of the screening process. And there's no way for a medical school to extract certain aspects of AMCAS and deliver it to different people. They can't just like block certain parts of the app for certain readers. So whenever schools ask you to recreate aspects of your AMCAS in the secondary, my theory is they're basically recreating an application that they can divvy out to different screeners, and the screeners can learn something about you that the school wants them to know. And then they can compare people based on those questions specific that they're looking for. So they want to know what are your 3 meaningful experiences, and you only have 500 characters, which is less than the main 700 characters. So you're not really writing a meaningful description here. People are always like, how do I take my 1325 and drop it down to 500? You're not. You need to rewrite these because there's no way to do that. You just have to get right to the point. This is what you did. This is how it impacted you. This is what you learned that you're bringing with you to the future. So you can apply it directly to medicine at the end. So the first question, elements of your app that might be concerning to the admissions committee. Most people are concerned about their MCAT, their GPA, or their lack of clinical experience. If there are other concerns like an institutional action or a misdemeanor, something like that, you have your extra 1325 characters in the app to explain that. So if you feel like you have more to say in addition to the 1325 characters that you've already written, then you can go on there about it. But primarily this is, I would say 90% of the time I'm reading things about MCATs and GPAs. So you know, there you can talk about your MCAT in a way if you think your MCAT is low. I really wouldn't write about your MCAT unless it's like below a 507, because if it's below a 507, like a 507 and above, I don't think most med schools are gonna like blink an eye at it. But if you think it's low because it's below a 507 and you want to address it, then you have to come up with something to say. And if you've only taken it once, it's kind of hard to say anything because you didn't take it twice, you didn't try again, you didn't see, you can't say you improved, you can't reflect on that process. You just kind of have to explain why it is what it is, right? Which is kind of hard to do. You can try to make up reasons, but honestly, a lot of people get low scores, and then it's kind of hard to explain why you have a low score. So if you want to open that can of worms, you can definitely try. I would try not to get defensive about it. I would just try to state things very matter-of-factly. If you took it multiple times, that's a positive thing. Highlight that and talk about what you learned about yourself as a test taker. You can always sort of try to address the fears that they might have about you as a test taker and say that, like, reflect on what you learned about yourself as a learner from having struggled or failed with the MCAT. And so be specific and talk about maybe how you grew from one test to another and how you plan on approaching USMLE as a result of learning these things about yourself. If you're talking about your bad grades, then again, I would only do that if it was a trend. I wouldn't do it for a single C. If you have 1 or 2 Cs, just let it go. Like, trust that you're okay. If you have an entire quarter or two of low grades, then you want to address it and explain what was going on during that time that led to those grades. Hopefully your grades went back up and you have an upward trend. So you can point that out and say, after this situation resolved itself, I ended up doing much better. You can see that by my last year or 2 years of school, my grades are drastically improved. That's what you want to say if you have to talk about your grades, is point out your upward trend. If you have low grades in your last year of college, that's a little trickier because how do you explain that you figured out how to do school and you're ready for med school if your last year of grades are not clear and free of any issues? So that's a little trickier, and you're going to have to come up with something to say about how you are prepared for medical school, despite there being some hiccups in your grades. In the last year, I mean. Is this question sent to only those who have a concerning factor after they read the primary app? No, it's sent to everybody. Well, no, it's not sent to everybody. It's sent to whoever they want to send it to. But it's not only people who have concerning grades, because everybody I read gets this and they don't all have low grades. If they don't have low grades, like if you don't have anything that's concerning, then you literally just say, I don't have anything that's concerning, or you leave it blank. You do not have to write something there. And that's honestly the best option sometimes. Okay, let's talk about UCSF. So UCSF gives you this really basic generic prompt that says if you'd like to expand upon any of your activities, you can do that. So I always encourage people to just pick 2 and just expand on your meaningful description. So just like you did in the paragraph for your meaningful, just kind of hone in on a different element of the experience and just talk more about what it is that you did. I would not repeat information from your application. So don't say the same things. Just pick something different or new to say about it. If you have nothing different or new to say about it, then you have nothing to expand upon. Therefore, you don't need to answer the question. If you have any changes in your app since you submitted, this is definitely where you update them. So for example, if you got a job between, the end of May and the beginning of July, then you would talk about your new job there. And then they want to know what you've been doing. Another question, actually, I need to update this because another question they ask is whether you belong to a marginalized group. And that is a very self-identified identity. You don't have to say yes. It is 100% up to you, but saying yes doesn't give you like a huge advantage. Saying no doesn't give you a huge advantage. It's more just like it gives them something to understand you in terms of how about your background and your, maybe your historic disadvantage. So sometimes people want to talk about like their family's, marginalization historically. I would say if you're going back like 2 or 3 generations, you really have to reflect on how the like your great grandparents or your grandparents' marginalization has trickled down to you and how you are affected by that. Just because your family went through a lot, 20 years ago, 30 years ago, doesn't necessarily mean that today you are marginalized. You are going to have to articulate why it is you feel marginalized. Um, and sometimes people struggle with that because they'll say, well, people like me are marginalized. And that's fair. You can talk about that, how you're like whatever your identity is, how generally the group is marginalized in society, being specific in terms of how that happens. You can also say that you yourself haven't felt marginalized depending on your own lived experiences. So you don't have to make yourself be marginalized if it actually isn't true, if that makes sense. And I think this is a conversation I have with a lot of people one-on-one, where they really grapple with that between believing that their like their ethnicity or their whatever group they belong to is, but not personally feeling that way. So it's kind of a tricky thing you have to navigate, deciding for yourself if that's what you want to write about. Okay, so UCSD is a fun one and it requires a lot of thought and it requires oftentimes several revisions. So this is something you don't want to just like throw together and submit. You want to write it really well and then have lots of people edit it and make sure it's well written. I'm going to tell you the way that I've had people write this for years and lots of people I've worked with have gotten interviews here. So I trust that this is a decent way of doing it. I always have people start with, I was born and raised. So where did you grow up? Who did you live with? What was your childhood like? Really paint a picture of where you're coming from. What was your household like? And that includes things like religions and languages spoken, where you live, where you move, what your parents did, siblings, and then kind of transition that throughout your life. So what were the big buckets about you? Are you a musician, an artist, an athlete? What were the big things you did growing up? Did you travel a lot? Did you have any major disadvantages? So you don't want the whole thing to be one terrible thing about your life after another. This is not all the bad things that happened to me essay. This is just a who am I essay. So you want to paint a picture of like the good, the bad, and the ugly, like all of it. Just give them I probably would try to focus a little bit more on the positive things because if you have an impactful experience description, they already read that before they got to this, hopefully. So they already have an idea of who you are, but this gives them a kind of an idea of the things that matter to you in terms of what you choose to talk about. So people sometimes will touch upon some of the same impactful experience stuff they've mentioned, but they don't spend the entire 6,000 characters telling their whole backstory in terms of all the bad things. I should definitely know what you care about by the end. I should know what you want to do and why from your lived experiences. And I always encourage you at the end to talk about why UCSD. So try to pull factors from your own life and tie it to the school, maybe even mentioning specific things at the school that would support your goals and your interests. So it's not that complicated. It doesn't need to have a theme. It can just literally be a chronological story of your life. You could put it in bucket, like you could make it more thematic by thinking about like the larger buckets of your life, like what are those big things about you? And then instead of listing everything chronologically, you can kind of put everything in a bucket and just talk about all the ways. Like, for example, if you ice skated since you were 3 years old to present tense, you could talk about ice skating as one big bucket and just mention all the things in one paragraph versus like keeping it all chronological. Any questions about UCSD? Okay. All right. I love UCLA secondaries. They're very long. It takes forever to write, but I really like it. So I've been saying, I think I talked about this in one of the earlier workshops I did at UCR. I talked about how, instead of just thinking about why medicine as a journey, what led you to the decision to pursue medicine, we're thinking about medicine as forward facing. So what is it that you want to do in medicine and why do you want to do that? And I think that UCLA's question really sort of proves, in my opinion, that this is what they're looking for. So they're saying, everyone is going to be an outstanding physician. Everybody can say that, right? Like this is kind of even funny just thinking about the way pre-meds talk about themselves. Like, I want to be an outstanding physician. So they're kind of playing on that. Like, okay, cool. You're going to be an outstanding physician. And what? Like, and so what? What else are you going to do? So they're looking to see what is your and. What is it you want to do? What do you care about? What are you planning on accomplishing? So in 800 characters, which is super short, you are answering, I want to be an outstanding physician and ... Very succinctly state what your goal is. So if you had already written about what you want to do in your personal statement, you should not be a different person here. You are the same person. Don't go too far off from what you've already said you want to do. If you have a completely different goal than what you've already stated in your personal statement, it might be a little confusing to them. So keep it in the same vein. You can rephrase it, put it in different words, but don't just completely mix it up. So what is it you want to do in your future? And then what have you done towards your mission? So that's like briefly mentioning some of the work you've done that supports your goal. Then the next one is basically taking each of these, I think there's 3 of them. Yeah. So your important volunteer work, your leadership, entrepreneurial, creative, or your research, basically. So how have each of these things supported your and? So if you say, I want to be a physician, I want to be an outstanding physician and a researcher in public health who looks at the impact of something, something, something. So then hopefully your volunteer work has aligned with that in some way. And you would talk about how your volunteer work supports that mission. Same thing with leadership, entrepreneurial, or creative. So creative can be a leadership experience as well, where you had to maybe create a program or create something that led to a better health outcome for somebody. But you're going to pick one of those and very succinctly talk about how that supports your goal. And the same thing with your research. If you haven't done research, it doesn't have to be literal research. It could be like something you studied in school. It could be a project you worked on. Or it could be a project, something you've done for work. But scholarly just basically means you've read articles. Like you need to have engaged in some type of learning aside from, it's not like an opinion piece, right? Like, so you need to show through your learning how how whatever work you did supports your long-term goal. So they're asking you to basically highlight your research. But not everybody does research, so you kind of have to be creative if you haven't done research. Okay, so those 3 questions tie into the first one. And all of those questions, all of that should be related to the same kind of theme. Then the next one, it's just a basic COVID answer. So that's I don't think I don't even know if it's going to be there this year, but if it is, it's basically just how did COVID impact you? And then this is the gap year question, the next one. And we already talked about that. And then this one down here is the same one as UCSF. So being part of a marginalized group, you can see the question, how has it impacted you or your community? So we talked about that with the last one. And it's the same thing. You just have to decide for yourself if you're going to say yes or no. And if you say yes, then you just have to be very specific in terms of how your group has been marginalized. Does anybody have any questions about any of this? Okay. Okay, so those were all of the UCs, and now we're going to get into some of the other California schools. Charles Drew is the newest med school in California as of right now. And so these are the questions as of last year. And similar to the other schools, they also have a mission for serving the LA County or LA community. And so you want to think about what it is that they're doing there and try to paint a picture that you want to also do the same things. If you have never worked in LA and you can't speak to specific experiences in LA, then you're going to try to create parallels with other communities that you've served. But you want to tie everything back to LA and talk about wanting to serve the community there. At the end of the day, they want people who want to work in their community. So you have to convince them that you also want to serve in LA County. Similar to the other schools, they all have a mission. They want to serve their community. You have to convince them that you also are right there with them. USC is a little interesting. They have these kind of fun / weird questions. And I'll just kind of walk through them. So things you don't care about at all. I always recommend you have at least you can have one silly thing, but try not to make it too weird. Like the goal is not to be weird here. The goal is just to show them things that you care about. When you show what you care about, you flip it to show what you don't care about. So let's say you care a lot about, trash in the ocean. You would say, I don't care about plastic straws because they all end up in the ocean anyway. So you would say, by showing what you don't care about, you're actually showing what you do care about, if that makes sense. So if you say, like, I don't care about ketchup on my hot dog, like, I don't learn anything about you from that. So don't just pick things just to be funny or weird. Like, pick things that actually mean something to you so that they can learn something new about you. What do you see as the physician's role in public health? So we have to think about what the physician's roles are. So when a physician's role could be in public health, it could be doing research in public health. It could be informing public health. It could be consuming public health research. It could be advocating for public health, meaning being a spokesperson, supporting them. So there are a lot of roles that they could play in public health. As a clinician, you're primarily seeing one patient at a time. So it's kind of hard to do public health as a clinician in the clinician role, but you could talk about knowing the public health, objectives that are out there, and then incorporating the public health agenda into your one-on-one clinical care. So there's a lot of different ways you could talk about this, but I would say think about things you've seen in your past and pull from a previous example of how you've seen public health being used as a physician. But you definitely need to think about it more from like public health and not just patient care. Any questions about that? It's a tricky one sometimes. Is there anything else you want us to know? I would recommend writing why USC there to just tell them why you want to be there. What is the most fun you've had is really an innocent question. Just what have you done for fun? I think they want to see that you can relax and have fun. So don't write that working in your research lab is fun. That's not what they want to read. If you want to give yourself a nickname, what would it be? So here's a chance for you to, again, show them another side of you, something maybe they don't know. So think about some element of you. Are you a baker? Are you a painter? Are you a snowboarder? Whatever thing you do that's kind of like just about you, come up with some funny nickname about it. And then you get to explain why that's your nickname. So it's not too complicated. It just gives you a chance to talk about something about you. The next question, a situation where you didn't get something you thought you deserved. I highly recommend not talking about like not getting a job, just because I feel like everybody probably is going to say, not everybody, but many people are going to talk about that. And, there are other ways, other things in life that you could be more reflective or vulnerable about. So one example would be if you've ever been like bullied or mistreated in some way, you could talk about, feeling like you deserved dignity or respect and having been mistreated, you didn't get that dignity or respect that you thought you deserved. If you thought you deserved, something from your parents and you didn't get it, as long as you don't sound entitled, um, you can reveal something else about you without, you just don't want it to sound like, oh, it was just so unfair that I didn't get this job and I was better than the person who got the job. So I just got a different job and I'm happy now. Like the number of times I've read that, um, and they end up saying, oh, it ended up working out better for me because look at me now, I have a better job than that person. It just kind of screams entitlement and I don't know, it never really sits well with me. So if you can try not to talk about just not getting a job, do that. If you can't think of a single thing, then I guess you have to do that. What does health equity mean to you? So you think about what equity means and you describe it in the healthcare context. If anybody does not know what health equity means, we can talk about it, but I assume you all know what that means. Someone asked, can we go over the first question again? So 3 things you don't care about. So we're trying to show things you do care about by flipping them and saying the things you don't care about. What can you ask a more specific question in terms of what you want me to talk about? I just wouldn't recommend writing about kind of frivolous things that don't have anything to do with anything at all. Like, I don't care about I don't care about, I don't know. I'm drawing an absolute blank just because I have to come up with something. Uh Anything. Like just any silly thing that has nothing to do with anything. But like if there is something you care about, then you try to reveal what you do care about through that. There's like bajillions of things you could avoid saying. Just think about like what are they learning about you from whatever it is you're saying. And if I'm a busy, tired doctor trying to figure out, who someone is as a person, does this thing give me any value learning about this, whatever you don't care about? So I'm not saying they all need to be like deeply profound, but sometimes I read things that are just really nonsensical and I'm just like, why did, like I think that people just try to be funny and they're trying to stand out, but sometimes when you try too hard to be funny or stand out, it really backfires because it's clear what you're doing and then it's not really doesn't have the same effect that you're intending. So I would say just like be thoughtful. You can still have a little fun with it, but you don't have to like be ridiculously obvious about what you're trying to do there. Okay, so Kaiser, describe your experience with a situation where you had an unfavorable outcome. How did you react? How might you have responded differently? These are usually pretty reflective. Their questions are pretty reflective. So you need to think hard about something where it's not necessarily a failure question. It's just like something that you were doing that didn't turn out the way you expected. So it could be a research experiment failed. It could be a relationship with a patient or a person in your life failed. Maybe somebody close to you left or passed away. I mean, how you responded, it depends on what you did wrong. So hypothetically, in this situation, whatever the outcome was, you should probably not have done the most perfect thing because then you can't reflect on how you would have responded differently. So maybe you want to think about an unfavorable outcome where you didn't necessarily respond well. And then what did you learn about yourself from the way that you responded? So you kind of have to show a mistake you might have made in the sense that like maybe you would have done something differently. So it's not like the thing you did, the experience isn't necessarily like I failed this, but how you responded to it is a failure. Does that make sense? And then the next question is, how do you contribute to the diversity of the school? So we talked about diversity questions last time. It's the same idea. You should talk about the value that you bring to the school. So if you imagine they have a table and they're sitting they're putting 8 students around this table, and they want the 8 students to all contribute to a conversation around healthcare and the challenges in healthcare. And they want to know, what is it you're adding to that conversation? What's the perspective that you bring to the conversation? So what have you seen in your life? What have you done that gives you a perspective that needs to be added to the conversation in healthcare? So your job is to show what that is. And it could either be from your own lived experiences, or it could be having witnessed things in others or studied something a lot, being an ally to a group if you're very close to a group. But you have to show like who you're speaking up for and why this is important to you. The second to last question, tell us about an area of intellectual exploration you're passionate about and have sustained over time. So this is not just your regular college. This is something that you have actively sought information for and became, like something that's you're passionate about it. Things that I've read in the past that are kind of interesting. Sometimes people are really interested in plants, like house plants, and they've shown how, the extent of research they've done to keep their plants alive. People have talked about hobbies like rebuilding cars and the amount of research they've had to do to get, to be able to build a car. It could be something like a particular disease, if you've been, reading and studying a disease for a long time, both in the classroom and in research labs. But it needs to be something that, you are a quasi expert on, because you should have been reading about it, pursuing information, getting feedback from others. And I don't know how long the sustained over time part should be, but I'm guessing more than like 6 months. That's just me arbitrarily throwing some dates out, right? But when I think of like sustained over time, it doesn't mean like for a month, right? That means for a portion of time in your life. All right. So this is another long one. They're all about 1,500 characters, so it ends up being, a couple pages at least. But oh, this is not Kaiser. Okay, California University. So a time you were faced with problems that tested your coping skills. What did you do? This could be any kind of problem, but you got to show your coping skills. An example of something you did that helped build enthusiasm in others. So you want to show a team that was lacking enthusiasm, and then show what you did that made them want to do the job. It could be any kind of, it could be a club, it could be a research lab, it could be a job. You could be working as a barista. It doesn't matter. You just have to paint the picture of the team that was struggling. If you don't paint the picture of the team, then I can't really see the enthusiasm that you're going to build in them. How would you describe yourself in terms of your ability to work as a member of a team? Well, I guess you just have to brag about yourself as a member of a team. So you would tell a story about a team you were on, that you did a good job, and kind of summarize your role on that team. Are you someone who likes to mediate when conflict arises? Are you someone who will support others? Are you the person who creates an inclusive space? Are you the one that keeps everything light and fun? So what was your role on that team? And describe the last time you were criticized by a peer or supervisor. So people have a hard time with this one because I don't want to talk about being criticized, but in truth, like this is the same thing as a failure. You actually need to show a criticism, not just like a disagreement or something they didn't like, but like an actual, like, you messed up on something. Don't be afraid to show that you messed up. So if you can think of any time when you got like harsh criticism or feedback from a boss or somebody, just be really honest about that and then talk about how you reacted to it. Maybe hearing the criticism didn't feel good, and you can be honest about that, right? But then maybe you reflected and you realized it was needed, and maybe you ended up making some changes to yourself as a result of that criticism. And I love this question about emotionally intelligent. So if you're not sure what that means, you need to Google it and spend some time studying emotional intelligence so that you can effectively show how you used emotional intelligence in the past. If you don't show this well, then it seems as though you don't understand what it is. So you need to make sure that when you tell your story, that you're really highlighting your own emotional intelligence. This is probably the number one question I send back to people and say you didn't answer the question, because people are not quite understanding what emotional intelligence is, which just in a very brief, simple way of putting it is understanding other people's feelings and behaviors and situations without being explicitly told. So if you can pick up on things happening without someone having to tell you what's going on, then you might have emotional intelligence. But if you literally have to be told exactly what someone feels or how the things are going or whatever, you might struggle with that. Hopefully you have some degree of emotional intelligence. What would be the best example that shows you're a person of integrity? Tell me a story about a time when you used integrity. So kind of challenges your sense of ethics a little bit. And then the last question is your basic diversity question. So, oh, the second to last one, where do you see yourself in 10 years? So these are all very heavy questions. This is a hard secondary to write. And you want to do this one really well, because I'm assuming you all would like to go to the school, or most of you would probably like to stay in the region. So I would say try to do this one really well so that you have a good shot. And they do take a lot of UCR students. So get help on these, right? Like don't just throw this together. Try to work with somebody, ask your advisors for help, do whatever it takes so that you are not just like turning in first draft writing. That's the worst thing you could do. But if you're thoughtful about all of these, then, and you're listening to what I'm saying, you're probably going to be fine. Just be really honest and try to be as vulnerable as you can. Try not to worry about, not looking good. I think sometimes people worry too much about, talking about negative things, but that's not necessarily the problem. Like the schools don't care if you're talking about failures or struggles or you not looking good. The more important thing is that you've reflected about those things. And if you can honestly say, I messed this up, I failed, I struggled, but I learned this, this, and this, they're going to appreciate you so much more, because in truth, like failure and struggle is normal. It's going to be normal in medical school. And if you're comfortable talking about those things, then you're going to be okay, right? They're gonna believe that you're going to be okay once you get there. So I think we probably have time to do, let's see how many more. We got 3 more. Let's see how many we can get through. Loma Linda is a little tricky because it does have a really strong religious undertone. They ask you for very specific questions about your religion, and also the last question, you can read it there. I would say most people who add Loma Linda into the primary don't necessarily realize that these are the questions they have to answer in the secondary. So then they end up wasting their money in the primary, because they end up not doing the secondary. So consider the questions and think about, like, are you comfortable answering these questions? And if you are, great. And if you're not, then don't add them in the primary. Don't waste the 40 something dollars to apply there if you're not going to do the secondary. There are plenty of other schools you can apply to that will give you, that you could use the money for instead. Don't waste money on schools you're not going to finish the secondaries. Stanford has another very long secondary, as you can see. The biggest thing about Stanford's that I would say you want to think about is thinking about their curriculum and the opportunity to sort of create your own. They have the discovery curriculum, and you can create your own path based on like master's degrees that they have or different scholarly concentrations. So go look at the scholarly concentration options that they have through the discovery curriculum, and really think about how what they have aligns with your career goals, kind of like UCLA's, right? So you want to talk about what is it you want to do, and then what is it that they have that's going to support your career goal. They have a drop-down list under the career goals that they make you choose. I think, you choose one in this case, and then you explain why it is you want to do that thing. So the schools are looking for you to be very thoughtful and reflective and honest about what it is that you see yourself doing, because the more you've thought about what you want to do, then the more they believe that you want to be a physician because you've actually envisioned your future. You can picture it. People who have no clue what they want to do, they don't know if they want to work in academic medicine, they don't know if they want to do research, they don't know if they want to go into public health. They have no clue. They just want to be a doctor. Sometimes those people don't have a very mature reason for wanting to be a doctor. Maybe that's just what they've always wanted to do since they were 3 years old, but they never really thought hard about why they want to do that. So it's important for you to be as explicit as you can about what your future looks like, because it says to the school that you've actually thought through your career and you're not just choosing a random career off a, list, or because your parents told you to do it. Okay. Any other questions about Stanford? Alrighty. Well, seeing you, I feel like their questions are pretty common, but the one that's interesting is the one about your pre-med advisor. Um, if you used your pre-med advisor at UCR or whatever institution you went to, make sure you say yes and talk about the relationship you have with that person. A lot of med schools want students to use their pre-med advisors, so using them is not a negative thing. Sometimes I've noticed that people will say like, no, I did everything on my own, and talk very proudly about that. And that's not a flex. You want to show that you do use the resources that are provided to you. So, yeah, if you went to a school that has pre-med advising and you intentionally never use them, then just tell them why that is. All right, so we're gonna wrap it up here. Does anybody have any questions for me about anything at all that I've talked about today? No questions about anything? All right then. Well, thank you so much for coming, and I wish you all the best as you write your secondaries for this season. Hopefully it goes smoothly. And if you do have any questions, feel free to reach out. If you're a UCR student, HPAC can help you throughout the summer. And if you're not a UCR student, then you hopefully have an advisor or good friends or a community that you can work with to help you get these done, because it's definitely a really hard thing to do and you want to get help. You don't want to do it all by yourself. All righty. Well, have a wonderful day, everybody. I will see you around.